So Michelle asked us to come in this morning and just comment on what happened yesterday, keeping in mind, think about one thing that surprised us and one thing that we're thinking about differently now. And I'll say that one thing that pleasantly surprised me was the emphasis on collaboration, like right out of the gate. I've done a lot of these sort of large consortial projects, and a lot of times that's just not even discussed or thought of. It doesn't really happen that often. And it's not just the emphasis on collaboration, it's the true understanding that it's hard. It can be hard for people to let go of something that they've spent a lot of time and effort building if it's not the right thing for this particular project. And I think that's very helpful and very useful. One thing I'm definitely thinking about differently now is how we're comparing the Human Exposome Project to the Human Genome Project. And we heard a lot of that yesterday. And I think a big difference between the two projects are the implications. So for example, if you find out that a gene causes a disease, it's not really anyone's fault. There's no one to sue, there's no one to get mad at. Maybe your parents, I don't know. But if you find that an exposure causes a disease, well, that's going to have financial or legal implications. And it's not always going to be that easy, of course. But someone brought up the tobacco use case yesterday, and I think that's a very well-documented case study of what could be expected from the results of the Human Exposome Project. Of course, not all exposures will be as straightforward as tobacco, but an outcome of this project could be along those lines. And it's not just industry that might push back on something like this. Individuals have attached their identity to things like their jobs and where they live and where they're from, and they don't want to hear, they're going to feel attacked if we come out and say that something that they're doing is having a negative impact on their life. And so that's something that we should think about, and that I think about differently now.
Your last remark is reminding me of the perennial studies on dark chocolate and red wine, and how personal people can get about their wine habits based on whatever literature's been recently published. So by way of background, I've somehow snuck into this room as a venture capitalist rather than a scientist. And in reflecting on the discussion yesterday, what struck me was two things. The first was sort of the breadth of data that is now available. I particularly appreciated sort of at the end of the day the discussion by so many of our colleagues around the world in terms of the open data sets that are now accessible to all of us and increasingly enabling collaborative science. On the other hand, throughout the day, there's such a grand vision for exposomics that sometimes as we think about it from an industry perspective, that vision is occasionally incongruent with the velocity of execution that is required for quick wins. And I think particularly in this moment with where we are in terms of scientific funding and sort of the opportunities ahead of us and so forth, what we need now more than ever is some wins that really demonstrate to funders, to industry, to politicians and so forth, the power of doing this kind of work. I think everyone in this room probably recognizes the utility and value of exposomic research. But I think we're still at the early innings of demonstrating, to outsiders that, that we're there. And so there was a comment made early in the morning around how in the Genome Project, things started small, right? You're thinking about a particular gene, or just getting, we're ignoring all the non-coding regions. We're sort of, starting at a place where we're able to begin to demonstrate, how useful this could be. And in a follow-up discussion later in the day, I recall someone's remark around talking about can we just get to a place where if you were to pick a random person in this country or that country, we know and can annotate 90% of the exposures we expect to find in their sample, right? Or some kind of measure bar where we have a reference exposome that enables us to, then begin to go and do more granular work. And so my reflection from yesterday is there's huge opportunity in the field, but that there's I think an acute need for focus on some short to medium term wins to continue to build sort of up the substrate for future research.
So I'm a pediatrician, and I'm also an environmental scientist. And when I was asked by Michelle to do this, I thought I would do some homework first because I'd never been part of a big program like this. And so I started listening to podcasts. So basically imagine you're visiting your parents at a holiday and you're sitting around the table and your dad's telling you how great podcasts are and you're rolling your eyes. That's basically me because I just discovered it. And what I did was I listened to Make America Healthy Again podcasts. I listened to podcasts about longevity. I listened to podcasts by Simon Sinek, who I think Gurdane probably knows in the business world, who talked about how to evoke change, cultural change in a big institution and what you need. Because I was trying to understand things that I had no training or background or experience in. And one of the things I realized from that is, one, there is a very strong commercial element to exposomics, and I do think it's in lifestyle and longevity. And there are big movements happening in lifestyle and longevity. And this is a moment where I think we can tap into that. And if we allow politics to get in the way, we may miss that, because these are potential allies that actually could help get this across the finish line. And so I'm very excited, and I'm actually more optimistic than I've ever been about us getting a Human Exposome Project off the ground. And so, and also I would encourage you, if you want to understand the priorities of the new administration, listen to some MAHA podcasts. It may actually surprise you how environmentally friendly they are.
Okay, what surprised me most, actually, in the beginning of the day, to learn that Miller and Vermeulen were the same name. And I was wondering if I should change my name to Meunier just to belong better. I mean, it's but I think what I learned mostly is what's happening almost everywhere in the world in this field. Actually, we are used to know better what's happening in Europe, in the United States, but yesterday, and I think today also, we will listen more to what's happening elsewhere in the world, in Japan, for example, in India, in Africa. And these are things that I was not completely aware of. I mean, when I saw all the cohorts happening in Japan, I knew JEX, but I mean, all the other cohorts that are extremely relevant, what's happening also in India and the activities in Africa, that was really, I learned a lot here. And I think we should develop that much further in the future. I mean, I know people in public health that are more in infectious disease, and they keep interacting, with all the countries all around the world. I mean, you see the Pasteur Institute, for example, they have institutes everywhere. I don't know if this shouldn't be an example that we could follow someday. They are located so many different places. So I think we should learn from those guys more into the infectious disease to open up much more, and this is starting. I learned this, and I think this is something that we could keep in mind and as maybe an outcome of this meeting today. I think we should open to the public now. Whoever would like to give an opinion or a reaction from yesterday. You don't have to say that it was fantastic. I mean, you can be maybe critical.
So that's a fabulous idea. What surprised you? What are you thinking differently about this morning than when you arrived, whenever you arrived?
I was pleasantly surprised and humbled by all the different kinds of biospecimens and biodata that has been collected. And I was thinking back, do we have something like that for environmental data? Is there an Expo bank where we can collect data? There are two reasons for it. One is we need to map as much as possible at a very finer grained level, and trying to get, say, air, water, soil, and other kinds of specimens, I call them exposed specimens, in a bank will be very powerful. And also, as we go forward, we'll have new methods of identifying things in there. So as right now, we have this high frequency mass spectrometry, which is really helping us to, it's asking me to go to a class. Don't worry about it. So basically, we need something like that. I think if the Moonshot program can look at that type of expansion where citizens can be part of it, I think we'll be able to sell it to a large audience and buy-in from doctors, buy-in from physicians, and buy-in from other scientists. Like I was telling in my breakout session, it is not that we need to sell it to the public, we need to sell it to the other scientists. It is not the group here who are already sold. We need to sell it to other people. And to do that, we need to have that type of things. Thank you.
Thank you very much. We can go here.
Yeah, great. My name is Bhagwat Prasad from Cincinnati Children's. I'm a pharmacologist, and I was thinking more from how our internal environment is affecting exposome, right? Our susceptibility to get affected by exposome depends on our internal environment also. And simply taking an example of a drug, when we're giving it a particular dose, we see a huge difference in the pharmacokinetics, for example, which is not only driven by genomics, but a lot of internal factors as well. So I think when we are considering this, we need to also consider how we are analyzing these data and how we are incorporating those internal factors that can be covariates for analyzing and interpreting these data in big cohorts, right? So any thoughts on how we can kind of integrate both the internal variability as well as external variability? And then simply taking an example of food, I mean, if you are exposed when you're taking food versus empty stomach, you have a huge difference in the absorption of the exposure, for example. So I think that is something that would be important to consider as well.
So could I comment quickly? So I love what your question is, and I wonder if at some level it's really about the difference between public health research and clinical research. So we focus a lot on public health because environmental health came out of the public health world, but what you're describing with terms of drug exposome interactions is really a clinical research question. And I think we need to move more in that space and bring these tools into clinical research. They've largely been absent from clinical research. Really, precision medicine would really benefit, and I think there are also economic opportunities there, or commercial opportunities there as well. I think that's a great point.
All right. Why don't we go up here? And
could I just follow up on this question? It's just that yesterday we were discussing opening this up to as many experts as possible. And it struck me, I don't think we have any microbiome experts in the room. And I think that this does come into exposome. So that's really all I wanted to say.
yeah, fabulous. You know, feel free at any exposome meeting or any forum where exposomics is being discussed to bring your friends. Because I think that's an excellent point. We need more people in this realm. So thank you for that. I also want to mention that I'm seeing more people kind of lining up, which is great. So I'm just going to ask you if you can kind of be succinct. So why don't we go up there?
Thank you. I'm Neil Thacker. I was really impressed with the degree of resources that are already available. And I've been thinking hard about this point about comparing this project to other moonshots and large, centralized science projects. And it seems the difference between this one and other environmental health studies is by looking at really hard at the interactions, is that the impact could be for not broad populations, but really tiny populations, people with rare diseases and the specific impacts on them. That creates a challenge that we've seen in other large science projects about the uptake of that information. It's even harder to transmit this information to scientists who are working on a rare disease and they're part of a smaller community. And so if there's a way to speed up that translation pipeline from the work out of this project onto all the other diseases and clinical implications, as you were saying, I think this project will be a lot more valuable. And to structure that in advance rather than waiting and letting the normal academic processes happen, I think could be very powerful.
Early engagement, awesome. Why don't we go over here?
Hi. Yesterday I was very much humbled by the amount of different lanes and different channels and different types of approaches that can be used for the exposome, but also raises, for me at least, a concern in terms of pragmatism, which is if we're going to do a moonshot and we're going to compare it with other types of moonshots or large initiatives, there were ways to crystallize what those were about very succinctly. And I feel like part of the success for these moonshot would be for us to really articulate quickly. And maybe the breakout sessions will help on that. But where our role begins and ends, what do we want to achieve, and what are we going to pursue? Because it can really just start spreading in many directions. And it's a field. We're not going to solve a field. We're going to pursue a goal. So the moonshot, the original moonshot was like, we're just going to beat Russia to the moon. That was like super quick, right? But we need some type of carrying card, common language that we can relate people with so that we can explain the value of what we're doing.
Okay, add that to what you're thinking about today in your breakout sessions.
Hi, Elaine Fossman back again here. I did want to, I am so excited about this, first of all, just so you know that declaration, but I'm going to say I think a challenge that we still need to address from yesterday and hearing this morning is that, you know, this idea of how people will react. And I think back to the statins. And so rather than changing diet, they had statins and therefore didn't change their exposures because it was so easy. And of course, the large component in the room today are the anti-obesity drugs that all of a sudden seem to be curing everything. So people are continuing on, but taking that drug. So I think in what we think about and go forward for this is an elephant in the room that we need to think about. And so as we think about case studies, we might do a quick case study and think about that in terms of really getting people to improve their health, which ultimately helps Medicare and health in the long run. But I think we have to be realistic about where people go. And it's not always the most public health intervention route. It's, can you give me a pill and cure all of this? So I think we're in a tremendously good position to do that, but I think we have to articulate that, and in particular for venture capital. Sorry.
Wonderful.
Just
Thank
one
you.
quick comment.
Yeah,
You
yeah.
just summarized 90% of the Maha podcasts. Seriously.
I guess it's because my nephew is involved with Google Podcasts. So.
Why don't we go up here? Yeah.
Yes. Hello, Agis Touros. You asked the question, what surprised us yesterday. I was surprised. I heard so few references to climate change and the Sustainable Development Goals. I think this project is highly relevant and linked to the global momentum to address the threats and everything that comes with it. The second issue I wanted to bring up is the conversion of this information into policy. I think we are scratching the surface now. It is very complex. There are other competing movements that demand also a change of approach to how we perceive health, what we need to do, and so on. And we must find ways to speak to others, to integrate this kind of knowledge, and engage early politicians and policymakers into this.
Fabulous. Thank you very much. So we've got 3 people at podium, so let's do 1, 2, 3, and then we'll wrap up.
All right, thank you. Wei Shui Chu, Texas A&M. So I think what surprised me was the idea of commercialization and that potential. And actually it came up in our breakup group, a group yesterday, and you know, I'm glad to see the venture capital here. Now I have a number of cautions of that. One is Theranos, right? Sarah Holmes is actually in jail in the county that I live in. And then 23andMe, right? So all this data goes belly up, and then privacy is uncertain. The other thing connecting to this I think the other caution is that commercialization is inherently pushing things down to the individual level, individual responsibility, rather than the collective responsibility as was discussed eloquently in terms of policy, right? And so that's almost, for many people, that becomes almost like victim blaming, kind of assigning they're responsible for their health. It's not that the social and economic structures have influenced that. And so that really connects again with the climate change and those type of issues as well. And then finally, just we've worked with the people in East Palestine after train derailment, and you think about the people from the LA fires. I think about how will this help them, right? For East Palestine, right, the train derailment, there's so many things that relate to policy, related to regulation of trains, just-in-time scheduling, all these things, having sensors that work, modern brakes, all these things that really are upstream of that. And then if we were to give them, their exposome now, how does that really help them? So anyway,
thank you very much. Awesome. Dennis?
Yes, I'm Dennis Arianis from the National Research Foundation of Greece. There were many things, of course, that were really humbling indeed in terms of data richness and also technological discussions. As I said in the morning session, I read books from the end to the front. And we're talking about the moonshot, and we have not described well enough what the moon is. Okay, we're talking about where we come from, Earth, with all the technologies, the knowledge, the data, the samples. We're talking about globalizing this, which is what we need to do, but we need to know where we're going to go. And I think, and how does this look like? Because indeed at the moonshot, there is a moonshot, people had some ideas about what they expected. Otherwise, they wouldn't have landed, put it like that. So I think that what is missing yet, I think we're getting there, but we're going to get there, but it is missing from yesterday's discussion is what is it that we're really trying to do, not to do, where we're going to go overall. And there are two elements I just want to say. On the one hand, I think we need to be clear, the exposome is about the individual. Okay, this is what it's an individual exposome. Prasad's point about differences in susceptibility, not only because of genetics, but also because of what we have been prior exposed to, are fundamental for pharmacology, for precision medicine, and also for precision prevention. And that includes also socioeconomic aspects, cultural aspects, different things, ethical aspects as well. But then, so the way going to public health from using the exposome, in my understanding, is not by just taking an aggregate on, which is trying to aggregate everything and sort of take averages that reflect the population. It's actually looking at the individuals, bringing it together to actually then come up with solutions for the population, and that brings us from, let's say, clinical applications to policy making, and that not necessarily in the public health sector. Because
thank you, Dennis. Thank you so much, especially for your passion. So take all of that passion with you to the breakout groups. We got one final comment, and then we're going to move on.
I'll be very quick. Lee Goldstein, Boston University. I think we also have an obligation. This is also an earth shot, right? Not just a moonshot. And I mean by this that the communities at risk, engagement with communities at risk who are going to be hit by climate change, who are already hit by lead exposure and other deprivation that impact our health. This becomes an opportunity for us to engage communities at risk, not individuals at risk, but communities at risk that we already know are at risk, and enlist their support, ask them what they need from us, and this becomes a political lever that can help move this forward. We're all here to help, and we need to be helping here on Earth, and I would say that that's a means of engagement.
Wonderful. Thank you so much. Thank you, everybody, for participating and adding your thoughts to the reflection. Thank you, Anne, Gurdane, Bob, and Robert. What a way to start the day.